So I'm Dr. Katrina Piggott. I'm a general internist and a fellow in the Geriatric Medicine program at the University of Toronto. I work with Dr. Paula Rochon and the Women's College Research Institute, as well as the Institute for Clinical Evaluative Sciences. I'm also a candidate in the master's program for quality improvement and patient safety because I'm interested in reducing harm in older adults and improving safety outcomes for them. I'm also interested in aging research because I think older adults are a very special cohort of patients. I think they have complex physiology and challenging problems, and everyone is different. And I think they need more holistic care and advocacy within the healthcare system. The project that I'm working on with Dr. Rochon has to do with prescribing cascades. Essentially, a prescribing cascade is a problem where if someone receives a drug, they may experience a side effect from that drug. And if that side effect is not recognized as a side effect, if it's treated as new disease, that patient may end up receiving a second drug to treat the side effects of a first drug. And it's a big problem. We know that prescribing cascades can contribute to something called polypharmacy, or just an accumulation of too many drugs. They can really contribute to pill burden, which is hard for patients. And it can also certainly drive healthcare costs, as well as lead to other adverse outcomes like confusion, falls, hip fractures, etc. So prescribing cascades are a major problem in the healthcare system, but it's challenging because prescribing cascades are difficult for clinicians to identify. So we were interested in looking at how we can help doctors identify prescribing cascades, ultimately so that they can stop them. We began by looking at the current curriculum for how doctors are taught about medications and prescribing cascades, and thought about how that might be improved. And we also reviewed popular medical resources that teach young trainees about medications. And then finally, we interviewed some patients as well as their caregivers about their experiences with prescribing cascades. And what we ultimately developed was a tool to help prescribers, help any kind of doctor, identify prescribing cascades, as well as understand them so that they can stop them and prevent them in the future. I think the results of the study are important because there are a lot of physicians and allied health who work with older adults who are taking a lot of medications. And many of these patients may be experiencing prescribing cascades without knowing it. So really, clinicians need to be vigilant about prescribing cascades, and I think that this tool would be very helpful in that regard. And I was recently able to present the results of this study at a national symposium, the Canadian Conference on Medical Education. In addition, the results of the study are currently in peer review at a major scientific journal. More importantly, I hope that the tool is actually something that will end up helping physicians learn about prescribing cascades, be more aware of them, screen for them, and identify them so that at the end of the day, patients aren't taking medications to treat the side effects of their other medications, and they don't run into drug interactions and other harm. And ultimately, patients are safer as a result.